Well, welcome everybody. We're glad you're on the call today. My colleagues are with us today are Bobby Foster. Bobby is with CCP of Scott County, just like myself, and she's our prevention strategy coordinator, something like that, the Scott County Partnership. She works with our DMHA Community Prevention Block Grant. And then we have Jody. And Jody, I'm like just running a total blank right now. Jody, what's your last name again?
No, that's all right.
Okay, that's right. And Jody is with the Indiana Addictions Issues Coalition and also with the Hamilton County LCC. And Allie is what we call her, or Al, with Solutionize, our web designer. And we are so happy that you are all here with us today. Again, if you're just now getting on, if you would please click and rename yourself with your county's name and your name. We'd really appreciate it. We just want to welcome everybody. I'm going to put up a few slides. I'm the LCC coordinator for Scott County for just a few more days. I'm actually kind of sad to tell everybody that I am taking a brand new position as of May 3rd. As the guest services and booking manager for the Country Lake Christian Retreat Center down in Underwood, Indiana, that's owned by Southeast Christian Church. So you are in such good hands, though. We have such a great team here that we're excited to carry on what we're doing. So again, today's webinar is on regional prevention hubs and the regional council. And we are excited to have the team from DMHA, the Division of Mental Health and Addiction. And Cyrilla Blackman is the Deputy Director of Youth Services and Addiction Prevention. And she has asked one of her wonderful staff, Jeannie Bellman, who has an MSW and is the Prevention Coordinator for DMHA under FSSA. And also, of course, Corey will be sharing today. He is one of our managers with ICJI, and he will be sharing a lot of news and updates. And so just to remind everybody, hopefully you're using this great tool. Hopefully you've already onboarded. If you haven't, you can write in the chat box. If you haven't been getting emails from me and the team to tell you how to do that, please make sure you put your email in the chat box and we'll reach out to you. But this is the web address for the Indiana Coalition Network, and this is what it looks like. And there's the email for it. If you want to reach out, we have 58 county members and we're looking for more. We're going to have a big celebration if we can get up to 92. And there's the email, info@indianacoalitionnetwork.org. And you can reach out to get a membership form if you don't already have one. So without further ado, we're going to go ahead and turn it over right now. Let me stop sharing my screen to Jeannie Bellman. Jeannie's going to share her slides, and we're excited to hear from you today, Jeannie.
Thank you so much. And yes, as Laura said, we're from DMHA, and actually we have Melissa Carroll as well. She is our Bureau Chief for Prevention, and we work really closely together on the regional system, and she will be actually presenting most of the information today.
So thank you guys for gifting Jeannie and I this time to review the regional system with you. We're going to go over some basic information about prevention and then dive right into the regional system, how it works, and who's involved. Okay, so I was going to start with our mission and vision statement, and we do want you to keep these missions and vision in mind as we move forward throughout the slides. So our mission is to reduce substance misuse and promote behavioral health across the lifespan of Indiana citizens by maintaining coordinated, effective, and accountable system of prevention and behavioral health promotion services. And our vision is to sustain environments that nurture, assist, and empower all Indiana citizens. to access and experience optimum physical, emotional, and mental health. So you will see this demonstrated within the system as we talk throughout the presentation. Okay, so what is substance misuse prevention? It's defined as utilizing elements of the public health model for planning and service delivery, and consists of inclusive practices, policies, and programs which provide individuals, families, and communities with necessary support to minimize the misuse of alcohol, tobacco, and other drugs, and maximize overall well-being. So what does all that mean? It means the overall goal is to prevent the onset of substance use or limit the development of problems associated with the substance. Our prevention efforts do touch on environmental prevention that does focus on changing community conditions and policies and hopefully decrease the availability of substances. Next slide. So what is prevention? There are 3 types of prevention. I'm going to fly by these slides for the sake of time. So there's primary, secondary, and tertiary. Primary prevention aims to avoid development of a disease or disability in healthy individuals. Secondary prevention would be early disease detection to prevent worsening of a disease and emergence of symptoms before the disease becomes severe. And then finally, there's tertiary prevention, which is to reduce the negative impact of the disease that's already established. So this illustration really pulls together how the conditions in which we live affect our overall health and how being healthy starts in our homes, workplaces, neighborhoods, communities, and even our social interactions. So this is why addressing the social determinants of health is so important, and the goal is to prevent individuals from falling victim to substance abuse where they will need secondary or tertiary prevention. Next slide. So when addressing risk and protective factors towards identified vulnerable populations, we use the National Academy of Medicine model that's referred to as Continuum of Care of Substance Use Disorders. So this model classifies prevention interventions according to their target population. And the following 3 categories are based on level of risk, which are universal, selective, and indicated. So we're going to break these down a little bit. So you have universal prevention that focuses on the general population and not individuals who are at risk or individuals with symptoms foreshadowing a disorder. You have selective prevention that focuses on individuals or group populations that aren't at risk of developing a disorder at a higher average than others. And then you have indicated prevention, which focuses on high-risk individuals who have minimal detection of signs or symptoms of a foreshadowing disorder or have a biological marker indicating a predisposition for a mental or substance misuse disorder. They also have no diagnosis yet. So why is this so important? Why do you need to know the difference of the level of prevention and its classifications? Because each community has different risk and protective factors that affect different age groups, races, sexes, you name it. And it's important to know the need of the community, who your target groups are, and what prevention programs can be used to best meet those needs. Okay, next slide. So we do receive federal funding from SAMHSA to provide primary prevention from cradle to grave. And out of the overall grant funding for both prevention and treatment block grant, 20% of that overall block grant funding goes towards primary prevention. Now, secondary and tertiary prevention are mainly funded by other departments. However, we can use additional funding if we have that to go towards those areas.
And we do try to focus on data-driven prevention. So these are some of our data sources. And if you're not familiar with them, you can let us know. If you want to find out how to connect with them, please contact us as well. We also do focus on evidence-based strategies. And those of you who implement prevention programming, I'm sure are well aware that these are strategies proven to be effective in the domains that you're trying to address. Within DMHA, we have the Evidence-Based Programs, Practices, and Policies Advisory Committee, and that is led by DMHA, involves other state agencies, and also subject matter experts. And then we also have our prevention leadership group, which Corey is also on with us. And the prevention leadership group is really to bring all of the different state agencies that work in substance misuse prevention together and make sure that we are collaborating and really looking at a statewide strategic plan for prevention. Next slide. Within DMHA prevention, these are our priorities identified in our strategic plan. And some of these we have made progress on, and some of those we're still working on. For example, the rates for underage alcohol use have gone down, but as I'm sure you all are aware, for example, rates of vaping in use have gone way up. So mixed progress on these, but these are kind of our overreaching goals. We have several funded partners throughout the state. We fund colleges and universities to provide prevention and wellness programs, community prevention, which some of you on the call here today provide, and that would be the primary prevention throughout the lifespan. FASD is fetal alcohol spectrum disorders prevention, and that grant is through Indiana NOFIS. We fund a few communities to focus on the older adult population and providing prevention programming to them. We also fund MHAI of Indiana to provide ICRUD and ICAN, and that's the Indiana Coalition to Reduce Underage Drinking and the Indiana Collegiate Action Network. And those are, again, both focused on underage use. And then we also fund training, technical assistance, and evaluation support vendors for all of our other grantees. And then lastly, we contract with an independent vendor to manage and coordinate the prevention regional coordinators.
Okay, so now I'm just going to go over a brief history of how the regional prevention system came to be. So in 2016, SAMHSA did a site visit and recommended building capacity for substance misuse prevention for Indiana using the Strategic Prevention Framework. In 2017, a Prevention Congress, or you may know it as Winter Congress, was created to address systemic change and to explore the development of the regional system, as well as review the development of the state strategic plan for prevention substance misuse. So part of our strategic plan is to address health equity and capacity. In 2018, the Prevention Congress affirmed and framed the regional system to focus on system impact. So there were focus groups that would determine what the regional system would look like, and the focus groups came up with the 5 pillars of community public health that would serve as a guide to the development of the system and the onboarding of the regional coordinators. And these 5 pillars are leading, convening, training, disseminating, and partnering. Now, the purpose of the 5 pillars was to engage communities so that communities don't feel marginalized. It was to ensure that we included communities and do things with them, encourage more dialogue with the communities instead of going into them and telling them what they needed to do. And this in return could help with things like policy so that it's embedded in them and they have a stake in the changes that would take place within their communities. And then in 2019, the Prevention Congress defined the regional system design from the lens of system and community capacity. So this is important to note because we are not focused on programming, but systemic change and how it affects the community. Now, the Congress fine-tuned the role of the regional coordinator and helped determine the boundaries within the state. So we have 10 regions. And in 2020, the Prevention Congress guided how the regional system would integrate elements of our strategic plan. Next slide. So here you'll find the state regional prevention map, and this may look different for other state partners, but this is what came about after much conversation with the Congress. This link will take you to our prevention page that will go over who our prevention partners are. So it'll include our regional prevention coordinators and others like who provides our technical assistance and evaluation for our Block grant funded agencies, our evidence-based work program, prevention leadership group, and many more partners. And we also want to let you know or understand that the regional coordinators are managed again by independent contractors, so they won't have a state email address, it'll be an external one. And next slide. So the regional prevention coordinators work with community influencers. These are going to be your prime movers, champions, and stakeholders to build bridges and address barriers in the interest of helping prevent substance misuse, promote mental health, and reduce marginalization of various populations around the state. So each region is empowered to identify and build bridges to reach their locally identified goals for reaching substance misuse behaviors and promoting mental health. Next slide. So as mentioned before, DMHA does partner with an independent contractor that manages the regional system and the coordinators. So regional coordinators are chosen through a 2-day process. And once a coordinator has been chosen, then they will start to go out into the community and identify and meet with those community influencers. Now the coordinators will then choose, the coordinators will then choose influencers who will hold a seat on the client consultation board or a CCB. Now the CCB is made up of those influencers. Remember, those are your prime movers, champions, and stakeholders. And the goal of the CCBs are to discuss how to address systemic change. And it's important to note that there can be more than one CCB in a region. And it's also important to note that the coordinator will facilitate the discussion that takes place during these meetings, but their main goal is to simply listen, take notes, and just move the conversation along. So each coordinator will then ask the CCB to elect one person to be a part of the regional council. And this regional council is a group of individuals from each region that will attend the Prevention Congress to inform DMHA on prevention efforts. Next slide. So here's a diagram to help break down everything that we just talked about. So working from the outside in, you'll see squares that say RC followed by a number. RC stands for Regional Council, and the number represents the region. And under that, you'll see CCB. Again, that stands for Client Consultation Board, made up of influencers. And next to that, you'll see a number. This number represents the number of CCBs held in that region. You'll then notice arrows from the RCs to the large circle in the middle that represents DMHA Prevention Annual Congress. This is demonstrating that communication works both ways, that the CCBs and the RCs communicate to the state on prevention efforts that are taking place within the communities in the region. And we as the state who hold the EBP, PLG group, SEOW, TA eval, take information provided from the regions and apply them to our prospective areas, as well as communicate to the regions on state initiatives, as well as request feedback on the needs of their communities. So this is a great example of how the system makes sure we all work together and feed one another information that will help the state keep line of communication open, and for communities to use the RCs as their soundboards to deliver community needs and prevention efforts currently taking place, and for the state to communicate to communities of changes within our system that will better support their communities and as a result, close gaps and improve policy and prevention program efforts. Next slide. So again, the coordinators serve as that link between DMHA and local community organizations, service providers, service recipients, and all community members that help address gaps and facilitate information exchange to prevention substance misuse, to make sure that we can develop and sustain communication networks and continue to identify gaps between needs and resources, as well as serve as a direct voice for the region to the state and a direct voice for the state to the region using elements of transparency, choice development, mutual collaboration, and empowerment. Now, again, their job is to listen and to facilitate the conversation and provide feedback to DMHA, but never their own opinions.
And the role of DMHA in the regional system is really to utilize the information obtained from the regions to, again, coordinate with our local, state, and national partners and strategize ways to address all of the gaps and barriers identified during the regional councils and CCBs. We also utilize this information to guide funding and resource allocation. As an example of that, we recently have been reaching out to our client consultation boards to identify ways to use stimulus funding that is on its way. We also share information with the communities via the regional coordinators. So if we have announcements, training or funding opportunities, we will spread those out through the coordinators, knowing that they have more contacts than we might have within the state office. And lastly, we are here to answer any questions or address any concerns that you might have about the regional prevention system. So if something comes up and you're not quite sure how it's working, you are always welcome to contact Melissa or I here at DMHA. Next slide.
Okay, so that leads to what's your role in the regional prevention system? So we need you in order for the system to work. So please use the coordinators by communicating with them to inform them on gaps, needs, resources, and even your successes in substance misuse prevention. And please feel free to connect our coordinators with other community members and agencies, because the system is meant to help. So use it, benefit from it, and allow it to enhance what you're already doing. And with that being said, we want to thank you very much for sharing your time with us and learning about the regional system. We're excited to continue to evolve and continue this work. And I think that leads to our frequently asked questions.
Yep, and I think in the interest of time, we'll also let people ask some questions. If you are interested in being on the client consultation board or your regional council, please get in contact with your coordinator. And that list is on our website. We can also send that out as well. And then we'll make sure that that this PowerPoint is shared with you all so that you have the link as well. And then if you go to the last slide, Melissa and I have our contact information on there as well. So I think we'll open it up, if that's all right, to anyone that has questions.
We used to have an LCC coordinator for Dearborn County, Bevan. She is now one of the regional coordinators, so that's pretty cool. Thank you, ladies, for such a great presentation. I know that this is very useful information to know for our LCCs. Corey, did you get any questions to come in when you guys reached out to, you and Sadia reached out to the LCCs?
Yeah, I sent those over. I sent the one question that we had. I sent that over to Jeannie. So, and they addressed kind of, I think the questions were distinguishing what's the role of LCC's involvement with this, and what's the role of the regional coordinators, and how do they work together. So I think that was addressed in their presentation. So
great. Monica from Hamilton County, thank you so much. Monica has said that Jason has been very helpful to Hamilton County. That's great to know.
Yes, thank you so much. We love Jason.
Anyone else have any questions? Has any, go down to your screen where it says reactions and put your thumbs up if you've been involved in any of these meetings so far for your county. Great. Awesome. So looks like some of us already have a good awareness and understanding of these. And the purpose of this was just to really help the LCCs to know what was going on. You know, sometimes CJI, we're all under CJI, and this is all under DMHA. So it's great that we can all come together and understand how this can benefit all of us. Jenna from Du Bois said, Susie has been an excellent to Du Bois County. She's already attending our meetings and moving forward with her efforts. Super. I know we have felt the same way about ours. Linda Henderson is Scott County, so we feel the same way about her. Okay, well, maybe people still thinking about a question. We'll go ahead and have Corey Smith share with us any latest CJI news or updates that we need to know about.
Well, I mean, nothing really exciting. As usually, it's not ever very exciting. It's doing a lot of reviewing right now. As everybody knows, we had the CCP submissions that occurred on April 1st. So I kind of wanted to talk about that and where we're sitting at, just to give everyone an update. So in 2020, we had 87 LCCs that submitted a CCP, but this year we had 88. So yay, got an extra one in there, which is good. We're good. We're glad, because that means that there's one more functional LCC out there than there was the year before. So great. So really, when we review these, it's a pretty, I would say it's not really detailed. We're really looking for a few different things. Really, we're looking for completeness of the plan. And then we're looking at SMART goals, and are these SMART goals achievable based upon the funding that is available? And then the third thing we really look at is funding calculations, because we use the funding calculations to determine if you're going to be compliant with the statutory code, right, with the statute, saying that at least 25% of the total fund needs to be in the 3 core buckets of prevention, treatment, and justice services. So at this point, we've completed an initial review of well over half of the CCPs. When I say an initial review, that's when Sadia and myself, we do our first look at it. And we identify if there are any concerns or issues that need to be presented to the LCC that need to be fixed, right? So really, something that we need to make sure that you are doing is just keep a close eye on your inbox, because if there is a potential issue that we see that we need addressed, we need that response back from you in a timely manner so that we can get these approved in a timely manner. If you're not paying attention to your inbox, or say if you step away for vacation for a week, make sure that you provide us with an email address or another point of contact in case something happens that we see while you're out of the office, okay? So the longer the delay is for us getting these approved, that means the longer delay it is for you being able to have access to the fund. Let's see here, what else I have? I guess the biggest issue that we have seen so far, which has kind of been a hurdle that we're noticing, and which probably tells us we need to do a better job of providing you with instructions and direction on completing it, is the last page of the CCP, which is the fund document. If those calculations are not correct, that is like an automatic, we're going to send it back to you to get fixed, okay? So generally, if the calculations are correct, it's complete, and it's somewhat achievable based on your SMART goals, then it's going to be approved. So after we do our initial review and everything looks good, we send a recommendation for an approval request to our management, who then will say, okay, they do their final review, looks good. They sign the approval letter, it gets sent back to us, and then we're able to issue those out to you and the county auditor. So really, when we started this whole thing, we wanted to make it, have these completed within a 3 to 4 week period. Unfortunately, there was, I always feel like something's always popping up, but unfortunately, one of our team members, she recently left ICJI, and she was a part of our approval process. So that basically made it so we only have one less person to do the initial review. So it's taken us a little bit longer, and also is seeing more of the funding calculation issues. So we're gonna have to, it'll probably be more along the 4 week to 5 week time period before we have all of these issued out, all the approvals issued out. So just bear with us. If you have any questions or concerns about the status of yours, just reach out to Sadia or myself, and we will do the best to inform you of where we are at with that. So If you have any questions, reach out to Sadia or I directly. Do not use the behavioral health email address. That is only for submitting of minutes, which, but reach out to Sadia or myself directly, not to the behavioral health email. Also, big things that we have coming up. We are having our team retreat in May, which we are going to do a revision of the LCC policies and procedures manual. It's not going to be a lot of updates, just things that we've noticed over the last year that we can provide more information on or be more direct with. So we'll announce that when that's finalized before we send that out to you all. Okay, so I think that's really it. So if you have any questions, just contact us. Okay. Thank
you, Corey, so much. Just want to remind you all again of the Thursday AM webinar coming up in May. Will be Kim Linkle, Coalition for a Drug-Free Batesville, nuts and bolts of coalition work. And I also want to remind everyone, if you're not onboarded yet, to please get onboarded if you have not. If you don't know if you are, please reach out to me and I will, or actually me or that email that we showed you on the slide. And we'll let you know if your LCC is onboarded or not. So also coming up in July, how to take advantage of the features and benefits of the Indiana Coalition Network work will be a really good opportunity to kind of navigate your way around it. So before we take off, we like to leave these final 5 minutes for questions and around the Zoom. I know that a lot of people have some great things going on in your LCCs, and now with a lot of things being done on Zoom virtually, that you're able to invite other people. So we're going to take this opportunity to go around, and if you want to make any announcements, I know Scott County has a great webinar coming up. Bobby, would you like to tell about our LCC meeting that we can also have other people, invite other LCCs to in June?
Yes, that's going to be June 3rd from noon until 1 o'clock. We have Sam that's going to come in and talk about the impact of legalizing marijuana, what it has on your businesses, your impaired driving records, social impact, all of that. And I will go ahead and put the link for that in the chat. And we'll also post it as an event on the ICN website. So if you don't pull it from the chat, go to the ICN, the Indiana Coalition Network.org, and it will be out there.
Anyone else have anything going on that you'd like to share?
This is my first meeting. I'm part of the LCC in Cass County, and I just want to reach out to all of you and tell you that if your school systems are interested in a good social and emotional learning curriculum, I can put them in touch with an organization called Lions Quest. My involvement is through Kiwanis, but I really think social emotional learning, especially in K through 6, is an important way to prevent kids from starting to use drugs and alcohol. So if you have a school system that you know might be interested in that, please reach out to me. And what information do you need for me in the chat? Do you want, what would you like? Phone number, email, probably
email. Yeah.
Okay.
Thank you. That's awesome. Yeah. Anyone else?
This is Leslie Robertson from Harrison County. I'm just going to piggyback on the gentleman's comments from Cass County. I'm involved with Southern Indiana Aligned with their prevention team, and that is actually one of the programs we've used as a pilot in a couple of the schools in Washington County. So I think it was well received. Of course, with COVID, we had to cancel several of our sessions. So hopefully that'll be up and running again, but we've found it to be a very good program. So agree with that. And Mary Beth Adams-Wolf with Our Place in Floyd County is very knowledgeable about that. She's actually the one that reviewed a lot of the curriculums we looked at. So if anybody locally wants to get in touch with her too, she has some information on that program.
Would you please send me your email address so that I can put people in
Sure.
By way of reference?
Sure, no problem.
Okay.
feel free to, because I kind of wear both hats with Floyd County and with our place. So, and actually had a hand in looking at the data that we
Okay.
got from those pilots. So if you can't get a hold of Mary Beth, you can get a hold of me, and I'll put my email in the chat there.
So that was Casey with Floyd County. Thanks, Casey. Great. Anyone else? This is exciting.
Hi, I'm Lisa Muser from Monroe County, and our LCC had a spring meeting last month titled Substance Use Disorder Stigma, Exploring Language and Beliefs. And that was recorded on our local TV channel. So if anyone would like to watch that, I'll put my email on the chat and you can just contact me and I'll try to point you in the right direction. Whoops. Let me try that again.
Thank you, Lisa.
Thanks.
Appreciate it. Very cool. This is so fun. I've been affiliated with the LCC since 2008, and this is the first time I'm actually getting to know fellow LCC coordinators. I just love it. This networking is so valuable. Anyone else?
I was going to ask the training that you mentioned, or the webinar, Bobby, that you mentioned, could you send that out in an email just so have a better record of when that is and everything? And then I was going to share too, and some of you I know have been through the same thing, having DFCs, but Floyd County received a DFC grant this year, and so I'm actually this week going through the National Coalition Academy training. It's really great. If you haven't been through that, you don't have to have a DFC to go through it, but it's been very helpful, and we've had another coalition member going through it with me. So far, it's been really good, useful, so I encourage you guys to look into that if you haven't been through that training.
And they would research that through CADCA, correct? That's Community Anti-Drug Coalitions of America. And that's called National Coalition Leadership Academy. Extremely valuable. Highly recommend it. And what's super special now is that you don't have to be a DFC coalition to be able to go through it. So, and now anybody can do it because it's virtual. So you used to have to go far away to attend it.
Lori, one other announcement. We're having our Drug Take Back Day this Saturday. And if other counties, communities are having theirs, or you're wanting to and don't know where to start, on the ICN, the Indiana Coalition Network website, we did a webinar on the Drug Take Back Days. I think it was in the fall of last year. And so there's a lot of resources and the webinar that are really helpful on what to do.
Again, we always say that this is the time that we wrap up our webinars, but we leave these last few minutes for networking. Cyrilla Blackman from DMHA just shared that DMHA also gets updates from CADCA and Prevention Technical Training Center trainings. If anyone is not plugged in, they can share resources with you. So you can reach out to them.
I just wanted to mention that Hamilton County Council on Alcohol and Other Drugs, we are in the process of developing a DUI PSA video. So I will share that with you and the group when we get that finalized, but I think it's going to be really good.
Oh, I love that sort of thing, because a lot of times those are not only appropriate for your county, but they're appropriate for other counties. So yeah, it's great sharing those resources. Thank you so much. Well, you all, it's been great seeing everybody and talking with you, and we'll see you next week. Again, it's the 4th. Let me look at my calendar. It'll be the May 27th is the 4th Thursday of May. And we look forward to seeing y'all again. Thanks for coming out. Take care.
Thank you.